of Hair show. We would be talking about the different stages of hair loss, specifically for the cases of pattern hair loss. So, if you go to any dermatologist and if you have pattern hair loss, this is how the dermatologist tries to understand the extent of hair loss and also to some level what the prescription medicines should be. All of this started back in 1950 where Dr. Hamilton and later in 1970 where Dr. Norbert, both of them did a lot of research on male pattern hair loss. They gathered about 1,300 men with some level of male pattern hair loss and later built something which is now famously called as the Norwood scale. The scale helps us understand the extent and severity of pattern hair loss and is used by almost every dermatologist now. Let's understand the different stages of Norwood scale. Stage 1 is where you have a full set of hair. Probably the first initial signs are that you feel that your hair are thinning and a little bit of increase in the forehead size, which is basically due to the receding hairline here. Stage 2 is where it gets more and more easy to or more obvious to feel that there is a hair loss problem where the receding hairline is going further. You compare your old pictures and you feel that your forehead is larger than before. Also significant thinning in the top part of your head. Stage 3 is where the bald patch is clearly visible. This is when your saloon barber is saying कि भैया problem हो रहा है, or your mother is saying that you need to do something about it. So that's how stage 3 is. And stage 4, even further recession in the hairline and a bald patch on the head. Stage 5, the two meet together to form a complete bald top. And stage 6, even more, and stage 7, completely bald. So these are the different stages of Norwood scale, and I'm going to just take like 2 minutes into this video to explain how a dermat prescribes various treatments depending on what stage you are. So stage 1, I have to say, is the best time to start taking care of male pattern hair loss. You have all the hair on your head. It's super easy to save and say stop or pause to this whole condition. Just a little bit about treatment across these stages. So for pattern hair loss, the two medicines that are clinically proven, there's more than enough research, more than 30 years of research done, and most commonly prescribed by dermats today are 1, minoxidil and 2, finasteride. Both these medicines work across these stages. Dermats pick and choose these on the basis on which stage you are, how old you are, and also whether the hair loss is more of a frontal problem or more of a crown problem. There are certain recent serums or molecules that have come up, for example, redensyl, which is supposed to help in male pattern hair loss. It's comparatively new. They have no side effects. They come from a more natural sort of background. For example, redensyl is made out of a bark of a large tree and has been proven for, especially in the cases of stage 1 and stage 2 where the hair loss is not to extent, when you are more in the preventive stage and you want to say stop to your hairline, works really well. So if you are a guy and you have this $1 million question that can a treatment help me solve my hair loss? Can a treatment help me get regrowth? And how long am I going to take to see this regrowth? This is the most common 2 questions that we hear when we interact with customers before they opt in to take the treatment. And that's why it's so important to learn about these stages. Right, so how soon are you going to see the results? What are the results going to be like? And will it be regrowth or will it be just saving my hair? All of this, the answer depends on the stage of hair loss and the age. Okay, so if you are in the bracket of stage 1 or 2 and you are thinking about taking care or doing something about your hair loss, that's wonderful because you have complete control of saving your hair. It will take about 3 to 5 months to improve the thickness of the hair, to recover any lost hair. For example, if you had a small patch here or a patch here, you will take 3 to 5 months and you will be able to regrow it on the basis of how regularly you use the treatment, also how your lifestyle is, if you're working out, eating healthy, all of that put together. 3 to 5 months is a good period to see visible results of hairy growth for stage 1 and stage 2. Moving beyond, if you are somewhere in stage 3 and stage 4, prescription medicines can still really help you out, but it is going to take a little longer. So it will take about 6 to 8 months to see visible results in terms of regrowth. Of course, way earlier during the treatment, you will be able to stabilize your hair loss. Um, Also, for all these stages, right, if you are on prescription medicines, it is very easy to control where your hairline or balding is, to not further move from stage 2 to stage 3 and stage 4. I know so many people who are still thinking and contemplating what to do about their hair loss and just wasting time till they reach stage 4 and 5. Whereas you can easily use prescription medicines to say pause to hair loss. If you are stage 5 and beyond, you can use prescription medicines to stabilize your hair loss, to control your hair loss. Regrowth, however, is challenging because it's way too into the end of this axis. Most dermats recommend hair transplant during this stage. We at Traya generally don't treat stage 6 and stage 7. We tell them that they need to see a dermat for transplant. Stage 5 depends on how severe the case is. If you feel that we can help them out, we tell them to try out the treatment, and if this treatment cannot help them, then nothing can. Only way ahead is transplant. There's one more factor that's very important along with stage is the age of the person. So if you are anywhere under 40 years, so anywhere between 20 and 40, and anywhere between stage 1 and stage 4. So across these stages, it is very easy to take these prescription medicines and control your hair loss, stop it where it is. But regrowth is something that depends on one, where you stand, the stage that you are in, and number two, on your age. So if you are anywhere between stage 1 and stage 4 and under the age of 40, so anywhere between say 20 to 40 years old, now this is a good time to trust prescription medicines, to trust a treatment where you can take some supplements, eat few things, apply few things, and actually recover your hair loss. However, if you are older or if you are beyond stage 4, either it's going to take longer than usual, or you will only be able to recover or at least say pause to hair loss. So, to best explain the importance of the stage of hair loss and your age to determine how much recovery or regrowth is possible and how soon, I've put here a clinical trial outcome which has three patients who are from different stages and different age. And this will help you understand that yes, it's good that if you are younger and you start the treatment soon, but even more than age, what is really important is the stage of hair loss. And that has nothing to do with age. We have customers who are 25 years old and already stage 3. So the big takeaway for men out there with some stage of male pattern hair loss is that hair loss is not something that you need to think when you are at stage 5. Then you have already lost the game. It's something you need to think when you are at stage 1. The sooner you begin, the better the results are, and it's absolutely easy and possible to manage hair loss.